Hi there. I'm going to explain a little bit about the process of inflammation and healing. Inflammation is just a term describing your body's reaction to tissue damage or injury, such as a cut. In fact, it is a very important part of the healing process, and there are two types: acute and chronic. Acute inflammation occurs just right after you're injured and doesn't last very long, anywhere from minutes to a few days. Chronic inflammation lasts a little bit longer, days, anywhere from days to months, and it's usually a result of your body being exposed to certain things that prevent it from completely healing itself, such as persistent infection or exposure to poisons in the environment. So acute inflammation happens soon after injury, and a clot forms in the wounded area to control the bleeding that occurs. This is just like a band-aid. Then blood vessels that are near the wounded area widen and open up to allow more blood flow into the area. Because of this, you're going to experience a few things. Number one, redness and heat in the area due to increased blood flow. Number two, swelling because of the normal process of inflammation. Cells that certain cells that were previously flowing in the blood vessels will now begin to leak out and travel to the site of the damaged tissue. This is good because these cells basically will remove and destroy anything that doesn't belong in there, such as other dead cells or nasty bacteria or microorganisms that may cause infection. Now, the next thing you're going to notice is pain. Pain and soreness occurs because of the swelling putting pressure on sensitive nerve endings in the wounded area. And depending on the severity and the area of the injury, you may experience a loss of function. But not to worry, this is all a part of the healing process. Now, after these cells go in and clean up the wounded area, other types of cells will begin to move in and further the healing process. Think of it as laying down the foundation and scaffolding for your body to repair the injured area. Depending on various conditions that may or may not complicate the healing process, you will experience either a prolonged phase of inflammation, which is the chronic phase I just described. You may experience a healing that produces tissue that is essentially normal, just like how it was before your injury, or you may experience, if the tissue is not able to be completely repaired, you may experience what is known as scarring.